are you able to extract hair from here and be able to give me a beard or a mustache?
They'll take longer than a 5-minute answer, a 5-minute consult. So
Just say yes or no.
well, we can. If we achieve hair cloning, kind of means we have unlimited donor. We're just gonna harvest 5 follicles, clone a whole million of them, and then just do the surgery. Young boy, early 20s, had a botched job in Turkey and killed himself because of how he hated how his disfigured hairline looked.
1, 2, 3, yeah!
Hello, my friends. I'm Alan Wu, and here we go. Today we have a very special episode. It's for every man or every woman who's looking in the mirror and asking themselves, am I losing my hair? Because today we have the one, the only, Dr. Joshua Chong. He is a board-certified hair restoration expert and the man behind Terra Medical Group. He is an expert in hair. We're going to learn a lot about hair loss, hair restoration. I can't wait to hear about it. Welcome to the show, Dr. Joshua. Good to see you again.
Thank you, Alan. It's nice to see you again.
I know that your father was probably one of, if not the first, anesthesiologist in Singapore.
Yeah, not the first, but he was one of the anesthetists that actually brought cardiac anesthesia to a greater height in Singapore during his training at Oxford University. Yeah.
Oh, wow. Okay. So how did you get involved with this whole hairy situation?
It is a hairy situation. So I think the topic of hair just came to me as a chance encounter as I was doing a bit of aesthetic work before that. So I left the hospital setting to pursue private practice and was involved in a bunch of aesthetic clinics, some doing facial stuff and another one that was also doing semi-surgical procedures, including robotic hair transplants. And I just realized that people were not really doing it properly. So having a little bit of my dad's nerdy genes, you went chipping away deeper into the information, delving deep into what textbooks have been written, attending seminars, conferences, trainings, and eventually getting myself certified with the American Board of Hair Restoration Surgery. Yeah, and then Terra came about.
How long has Terra been up and running for?
So we've had Terra, this would be year 7.
Oh, year 7 already?
Yeah, but altogether we've been doing hair transplants and hair restoration work for nearly a decade.
Nearly a decade?
Yeah.
Wow. Let's just get right into it. I think for a lot of people, they think hair is something that's very, very genetic. When it comes to hair loss, hair growth, how much would you say in terms of percentage is based on our genetics? How much is based on, you'd say, our diet?
Well, that's a very good point because the old and classical teaching was that hair loss in the male pattern variant was 90% attributable to genetics. Right? If your dad and your granddad were to lose their hair, it's very likely that you go down that same route. But we know that field of science is changing. We're probably attributing less to genetics and a bit more to what we call epigenetics, which are things in the environment that you consume, or maybe things like microplastics, things like ultra-processed foods that are increasing in concentration in our current lives that are seemingly turning on or off hair loss genes. So it's probably a less attribution to genetics right now and a bit more towards the other factors. Yeah.
I would say, I think also that's, do you think our lifestyle now, like our diet with all the different stuff that's in the food, do you think the rate of hair loss is even higher now than, let's say, 50 years ago or back in the past then?
Right. So there was a study that was published that showed that, in Asian societies, let's say China, Singapore, Hong Kong, the incidence of male pattern hair loss is quite the same as if you were to study a group in, let's say, Scandinavia. Okay. Yeah. The only difference is the age of onset. And back then, they found that the age of onset was earlier in the Caucasian populations and slightly later in the Chinese populations, Oriental populations. But right now, what we see in practice, that cross-sectional study has never been repeated, but we do see younger and younger patients coming in presenting with male pattern hair loss at a very young age. The youngest patient I've treated was 16.
16 years old.
That's
with
right,
already,
yeah.
wow.
Yeah.
That's really, really young. It's your mom's dad. If he was bald, then I would have hair loss. Is that? Have you ever heard that I think story before?
It's actually polygenetic. So we know of at least 27 hair loss genes that are well confirmed, and probably many hundreds more that we don't know about. And it comes from both sides of the family. And if you've inherited a bad hand, then you're more likely to lose hair. There's still that epigenetic stuff that comes in and switches on or switches off those genes that triggers the thinning of the hairs.
Let's say if someone doesn't have extreme hair loss, what would you recommend that they could try first, maybe in order to slow down the onset of hair loss, or I think try and prevent hair loss?
This will really depend on the diagnosis of what's causing their hair to kind of go away. We have to quite clearly draw a line between male pattern or female pattern hair loss, which is largely driven by genetics as well as those environmental factors that we talked about.
Okay.
Versus hair loss that's due to, for example, a medical condition, or hair loss that's due to severe stress or a severe illness like COVID or dengue. And they present differently. And if you're not too sure how to differentiate these diagnoses, you're never going to get the right formulation to treat it well. Right? So I'll just give you an example. I got COVID in 22 and I had long hair then, and I lost a bunch of hair just like from one day to the next. It was like a few hundred hairs coming out at each time. And as a hair restoration doctor,
Not a good look for a hair restoration doctor.
I still got shocked, right? I was like, what's going on? And I counted back the days. I was like, oh, it was 3 months since I had my COVID episode. And that condition is called telogen effluvium. What happens in that condition is that a lot of hairs enter a resting phase. So when the hairs enter a resting phase, or the follicles enter a resting phase, they shed, but they renew. And in fact,
They don't renew.
They do
They,
renew.
they do renew, okay.
And in fact, if you leave it alone, they grow back.
Okay.
So you could buy a fancy shampoo and you could attribute all that hair growth to that particular shampoo. But in truth, if you did nothing at all, it'll probably still grow back.
It still grow back.
Yeah.
Okay. Now I want to check with you also. You mentioned male pattern baldness and female pattern baldness. What is the difference between males and females in terms of their balding?
Right. So there used to be one unified theory for the both sexes.
Okay.
Right? It's called FAGA and MAGA, or female androgenetic alopecia and male androgenetic alopecia. Andro, referring to androgens or male hormones. Genetic, we know that refers to what encodes in your DNA. Alopecia is the Greek word for hair loss. Okay. But now we call it male pattern balding and female pattern hair loss, because we know that in the ladies, there's a lot more epigenetics that are surrounding this phenomenon where the hair slowly thins out. It's not just treating the male hormones. We have to assay them for things like their micronutrient levels, vitamin D being a big one in Singapore. Everyone likes to, slap on lots of sunscreen. They don't go out in the sun enough. They're hiding in their offices. We check them for iron deficiency. That's the most common mineral deficiency in the world. And ladies who, kind of have their monthly thing, you're losing iron, and if you're not taking enough, we fall into a trap of iron deficiency. And we look at various other medical causes that may trigger it. Common ones would involve the thyroid gland, some autoimmune causes, and so on. Yeah.
Okay.
But largely for MAGA, or male androgenetic alopecia, or male pattern baldness, we tend to see the majority of patients follow this pattern, and you'll be quite familiar with it. It's in all those charts where you see the Norwood-Hamilton scale, where the corners of the hairline go backward, and then the middle of the hairline recedes, and then you get this circle that opens up in the middle, and eventually you're left with a horseshoe shape of hair around the back. And that would be the natural progression if you did nothing. Yeah.
That was mine. I think I had a little bit of the receding hairline in the front, but I think as we get older, the reason for that is it also hormonally related. I think that with hormones, are changing hormones as males get older.
So that was a prevailing theory. The longer you're exposed to a certain male hormone, we call it DHT for short, dihydrotestosterone, pardon me, the more damage there is done to the hair follicles over time. And this hormone is present in all of us, male and female, at different levels and fluctuating levels over the day. So if I were to do a DHT test now and maybe like 10 hours later, there'll be different numbers. There's no value in testing that.
Okay.
But slowly, as the hair follicles in specific regions of the scalp are more sensitive to this hormone. They cause a shrinkage of the hair follicle, and resultant hair shaft goes from a thick strand to a thin strand. So you're not actually having hair fall out, you're having it fall out and grow back weaker.
Weaker, thinner.
And you multiply that by hundreds of thousands of strands of hair over the top of your head. That's where you get that shiny reflection.
Ah, okay, yeah. So I want to check, I think if I was someone that, let's say I came in and I was either young or old, are you able to diagnose exactly, specifically the reason for my hair loss based on all these different factors and variables too?
Yeah, we have been doing that, and it's mostly done by way of asking questions, right? Are you eating well? Are you sleeping well? Do you have a family history? Are you taking any medications or bodybuilding supplements or anabolic steroids that might be exacerbating the issue? When did it start for you, right? Which areas did you first notice there was hair loss? But we also have quite sophisticated tests, including lab tests, blood tests. There are genetic tests available to determine whether you've inherited one or more copy of a hair loss gene. We also have a 50 times microscopic scanner called the Tricolab Studio, where we can image different portions of the scalp, and it can give us a AI diagnosis, sort of.
Okay. I know there are a lot of these like scalp therapy clinics too, who claim that, if you have a very, very, obviously they'll take a picture, they use a camera, take a look at your scalp and see the follicles and see all the oil and all the grime and all the buildup, how that buildup can affect, I think, our hair growth, the health of our hair and everything too. Do these type of, I think, services help aid in hair growth, or are these effective?
Okay, based on what's available in the medical literature, if you look at nothing seems to mention that these specific treatments with rosemary oil or peppermint oil or steaming your head is going to reverse male pattern hair loss or female pattern hair loss.
Good to know.
But if you have a really mucky scalp, you should probably deal with that.
Yeah.
Shouldn't you? Yeah.
It's not helping your situation, right?
Yeah, it's not helping your situation if you're having a mucky scalp and you're losing your hair. So definitely get it professionally cleaned if you have to. But if you're expecting a bald head of hair to grow hair based on doing treatments once a week or once a month, just by cleaning it, I don't think that's how the hair follicle is going to repair itself.
Okay. And then there's so many products out right now, especially when it comes to hair products like shampoos, conditioner. They talk about, I think all this hair health, how it can generate better, how it can help you grow your hair. Do these products work?
Do you know in Japan, they've actually came up with a regulation to ban manufacturers or retailers from saying that this is a hair loss shampoo or anti-hair loss shampoo, because there's no such thing. There's no such thing as a hair loss shampoo.
Straight up, no such thing.
Shampoo is meant to be an agent to actually clean your scalp and clean your hair thoroughly.
Okay.
And a conditioner is meant to help your hair to actually maintain that moisture and the balance of moisture in your hair. It's not meant to stop hair loss. Yeah.
Oh, wow. Okay.
In fact, how long do you have shampoo contact with your scalp for, Alan?
Not very long, maybe. Not more than a minute, maybe. My hair's short, yeah.
Even if there were active ingredients on it, how much do you think gets through?
Yeah. In terms of just and that's absorbing it in too, right? It's not enough time.
It's just
unless you leave it there, even if you left it there all day, right? Probably not going to do very much.
Yeah.
Can you share with us? I also see, on the market right now, a lot of different products people can take. They can ingest it. They can also put these different oils or solutions on there. Let it be Propecia, Rogaine, and all these other ones from a myriad of brands I haven't even heard of that talk about hair loss, encouraging hair growth. Do these work?
Okay, so Propecia and Rogaine are the only FDA, for clarity, that's the US Food and Drug Administration approved methods of treatment for male pattern baldness. Okay. These are the only two.
The only two out of everything else out there, right?
Yeah, and they've been there forever, for decades. And they do work to varying degrees. And we know administering them in different forms now. You can spray on your finasteride or Propecia now, and you can take your Rogaine orally now. And so it's mixed up a little bit. And as we go on with new research, we are finding that, different administrations will benefit different population profiles. I won't get too deep into that.
Yeah, no need.
These are prescriptive anyway, so you need to see a doctor in order to get these guys prescribed for you, and they're for long-term use. So have a really good chat with your doctor if you're even thinking about using of these medicated supplies. But to bust the myth of biotin, collagen, etc.
All that stuff.
You would stand to benefit if you were severely deficient in biotin, and the percentage of the population that's deficient in biotin is less than 1%. Okay.
Not a very high percentage.
If your fingernails aren't breaking when you're just doing this, you're probably not lacking biotin.
Okay.
So taking too much biotin does nothing but create expensive pee, pretty much. Collagen, there's not much evidence that anything but one particular collagen brand, I shan't say what brand it is, but one particular collagen brand has done a study to show that it improves hair loss outcomes in female pattern hair loss. You've got those that mix it all up, and there are good stuff in there like anti-inflammatories, anti-stress, but they put in some vital ingredients too, like vitamin D and zinc, and those actually improve some people's hair loss if the causative reason for their hair loss was a zinc or vitamin D deficiency.
Interesting. But I think right now, in terms of, let's say, before I decide to do, let's say, something more invasive, which is to come in, let's say, for a hair restoration, do you think these topical things work better, or something ingested better? If I wanted, let's say, try that avenue, I guess it depends case by case, but in general.
We're going to have to split that into two answers because in terms of finasteride, we know that
finasteride is Propecia?
Propecia, sorry, Propecia. We call it finasteride as the trade name, we know that at 6 months, they actually have the same efficacy if you spray it on or if you take it orally. Okay. But at 18 months, oral tends to be superior to a spray.
Wow.
So it depends on how long you're going to be using it regularly. Now, in terms of minoxidil or Rogaine, about 40% of men actually lack an enzyme that converts Rogaine into the active ingredient that will make your hair grow, and that's called minoxidil sulfate. So Rogaine's a pro-drug. It converts in your body, in your hair follicles, in order to become the active drug, right? So what folks are doing now is to dose them orally, and the enzymes in the liver are then responsible for converting it into minoxidil sulfate. And it doesn't seem like we have many people around, definitely not 40%, they're lacking that enzyme in the liver. So oral dosing of minoxidil at, according to body weight certainly, seems to be more effective than using Rogaine as a topical agent.
No, I think one time you told me, it's interesting the way our hair grows too. Like there's a dormant phase, and then there's a phase when your hair falls out, and there's a follicular phase at a follicular level where it takes a while before it grows. How long is that whole cycle for our hair? Right. So people can understand that a little bit.
So the growth phase, or what we call the anagen phase, can range based on genetics. It can go from 2 years to 6 years in a normal hair.
Okay.
So folks that can grow their hair down to their bums probably have a really long anagen phase. Now that falls out, it goes into catagen phase or a transitory phase, and then into telogen. Telogen is a resting phase where the hair follicle actually shrinks back down, actually gathers more strength to go back into anagen again, and produce a strong shaft of hair. And that telogen phase is described as roughly 10 weeks in humans.
Okay.
And they can't happen at the same time. You can't have anagen and telogen having, two hairs growing out from one follicle at the same time, unlike in certain other mammals.
Okay. Yeah. Wow, that's a lot. Our hairs are quite complicated. It's not just one, and there's like single strand, double strand, 3 strands, everything too, right?
Yeah, so each follicle can only grow 1 strand, but on a human scalp, you tend to see them bundled into units. So sometimes 2 units, 3 units, and these are called follicular units. And the modern way of approaching a hair transplant surgery, compared to the old days where they use plugs. You've heard of hair plugs. Is to harvest hair follicle units and transplant the units because they naturally exist as units on our scalp. And these units may have 1 hair or 2 hair or 3 hairs or sometimes 4 or 5 hairs.
So I think your primary treatment is FUE, right?
FUE stands for follicular unit excision and extraction. We excise the follicular unit, we remove it from the skin. It goes through a bunch of checks. We want to make sure that we have enough in order to satisfy the density requirements over an area of scalp, and then we place them back in. So we're removing them, borrowing from Peter pretty much to pay Paul. So the net is actually a 0 increase in total hair numbers. You're just shifting hair from areas that you have excess,
It's more dense,
yeah, to areas that you need more.
sparse.
Yeah, that's right. Regenera
Yep.
or autologous micrograft transfers. So what that is actually a stem cell procedure, if you want to imagine it as that.
Okay.
We are using the prowess of the hair follicle stem cell, adipocyte-derived stem cells, which are fat-derived stem cells. There's some other skin-derived stem cells and blood vessel-derived stem cells in the mix. We are taking them en bloc, so it's hair and the surrounding skin tissue. We break it down in a machine. The whole thing actually takes 20 minutes. It sounds really long, but
Yeah.
that suspension that we get has about 180,000 live stem cells
Okay.
and about 50 billion exosomes, and it's your own, right? So it comes from your own body, and that's why it's called autologous, and it's injected into areas that you're requiring a little bit more density. And the end effect of that is a net positive. So you get thin hairs falling out as part of the process, telogen, and growing into a stronger anagen hair, coarser anagen hair.
So I would say that probably FUE, where you actually extract, I think hair follicles, I guess hairs from that's more dense into areas, that is more, I think, invasive in the sense that it is the Activa Regenera is where you have hair that's maybe just starting to be thinning and you kind of use it to kind of thicken it up? Or can it grow? Can I inject the Activa Regenera and have hair just grow there?
No, you can't. So
you can't, right?
It's a regenerative process where you help to so-called heal the partially damaged ones.
Okay.
Yeah. But if you want a brand new one, you're gonna tear it down and build it up again like a house.
If let's say someone before the onset of any hair loss, what can they do? Just in general in their lifestyle to maintain the hair that they have?
Let's start with my favorite topic, which is actually vitamin D.
Okay.
Now, we are chronically underdosed with vitamin D. The average Singaporean, we're talking about half of our adult population are actually vitamin D deficient.
Okay. Oh, wow.
And we do see that when they present as hair loss patients, we get about 91% of patients who present with female pattern hair loss are vitamin D deficient. If they're shedding heavily for many months, 83% of them are vitamin D deficient. Yeah. If they appear with spot balding, patchy balding, alopecia.
You're able to assess that they're deficient in vitamin D. How important is vitamin D to hair growth or hair health?
It's integral to the actual mechanism of growing a hair.
Oh, the cellular level.
At the cellular biomolecular level, it is integral. So it's not something that I would miss out in any kind of evaluation. And if I had just a hint of suspicion that this guy's not getting enough sun exposure, I would just suggest casually, just go get some vitamin D, mate.
Okay.
Can't do you any harm, right?
Definitely. You can never overdose or have too much vitamin D, right?
Oh, it's really rare.
It's really rare. Okay, so vitamin D is very important for everyone. If you want to maintain your hair, go buy your vitamin D. You can thank Dr. Joshua later on though too. What else do you have to share? What other type of tips you have everyone else though too?
Next thing will be diet, right? So lots of people have low zinc in their bloodstream, and then we know that low zinc actually is an independent risk factor for causing chronic hair shedding. So go and Google. There's a whole list of stuff. There are red meats, there are fish, there's liver, there's nuts and seeds, certain mushrooms that are rich in zinc, and you want to grab more of those, right? Sunflower seeds are a good source of zinc and very good fatty acids. They make for a great snack. Yeah. In patients who are taking too much in terms of sugary foods, as well as dairy products, these are the food items that seem to have a link to accelerate hair loss in susceptible patients, not everybody, but I would say if a patient came to me with hair loss and really oily hair and I tell them to cut their dairy, 80% of the time they're going to say, yeah, I see much improved. Right? And that applies for acne and as well.
Okay. So let's say I'm someone that is looking in that mirror, male or female, I start seeing that my hair is starting to thin.
I would say it depends on a variety of factors.
Okay,
so
those are?
Firstly, the time course. How long have you seen your drain, being clogged for? Has it been only a week? Could be a temporary shed, maybe returning from, Niseko, which you like to go to.
Yeah.
That climate change can cause a bit of hair shedding.
Okay.
Yeah. But if it's going on for 6 months, it's probably time to consult someone.
Okay,
right?
time is very important.
So the time cost. Secondly is expectations, right? So if you know you've got a family trait of being slightly on the thin side or having a higher forehead, and if you wanted to do something about it, you can certainly make an appointment to see a doctor. But we'll also in clinic manage your expectations, right? The apple's not going to fall far from the tree. In terms of the genetic outcomes in determining how you look. Can't look too different from your dad and mom, right? Yeah. So if you see your hair getting sparser and sparser, and that's a progressive decline, let's say over a few months to a year, it's time to get that checked, right? But you have to be vigilant in monitoring your own hair. And how I tell my female patients to do that is to center part their hair daily, using the same light setting, maybe in your bathroom mirror, and just observe that center parting, because that doesn't deviate. You have a reference point. And if that parting width seems to get larger and larger, you're probably losing some amount of hair. And for our male patients, just kind of eyeball your hairline every now and again. The hairline recession is really insidious. It happens really slowly. So if you're not quite too sure whether that's kind of afflicting you or not, then speak to a doctor.
Okay.
Right. Take photos regularly of yourself. And my advice is don't use the selfie camera mode. Get someone to do it for you. The selfie camera mode does a horrible job of taking hair photos. It always makes it look worse than it actually is.
Yeah, it looks pretty bad when you do selfies. That's why don't take them. Your hair won't look very good, I
It'll
think.
freak you out.
Yeah. What I realized, when I went through the treatment with you too, was just how quick it can be done though also. And the expertise is just being able to individually, in the past, I know they would have to graft a piece of skin with the existing hair in it and then be able to harvest them. Yep. Now you can individually take each follicle too, right? And then that's what I think that's what I loved about it. It can be done so quickly too. And the next thing you know, it takes a while to recover, but then it can all be done in one day. Pretty much the whole process takes a day.
Very seldom do we run into day 2. And that would be pre-planned. Like if we're doing 4,000-ish grafts,
a lot,
then we want the team to be still alive by the end of the 4,000 grafts. So we split it into 2 sessions. But by and large, it's a day procedure. It's done under local anesthetic, sometimes with a little bit of sedation. We're usually having a nice chat with our patients. They don't seem very bothered because it's numb up there. Yeah, and they're discharged with a bandage. Doesn't look very pretty, like a sushi chef. They come back the next day, the bandage is off, and things have already started healing.
Are you able to, extract hair from here and be able to give me a beard or a mustache?
They'll take longer than a 5-minute answer, a 5-minute consult. So
just say yes or no.
Well, we can.
Oh, you can. You can do it.
We can do beard transplants.
And I think you've done it before too for people. I just want to become from no hair, any hair here, to have a beard.
Yes, and we are limited by the donor area still, and we do want to make considerations for, if you're not bothered by your hair on top and you just want a beard, we'll have you sign off that you give us clearance to use up the follicles there for your beard. But it's always good to keep some in case you lose some up here, right?
Yeah. Would AI help out, or robotics? Would that make it, or is it better to just have you do it manually?
So I used the robot for 3 years-ish. Didn't like it a whole lot and ended up using manual techniques better again. The manual techniques now are really at the peak of their evolution. They can do it without shaving, so they can do long hair FUE. They can do curly hair, and if you know curly hair has a follicular shape that's a U. So a straight punch would cut right through it. But there are techniques now, or machines now, that can navigate that curly nature.
Oh wow! So the part inside is curled too.
It's a curl, and you plant it as a curled hair. Yeah. So those are technological forefronts with FUE. But if you're asking me, what do I see as the next big thing? It'd be hair cloning.
Oh wow! Yeah.
In folks, yeah. So it's a difficult architecture to clone, right? The hair follicle has multiple stem cells from different origins in the body, the skin, underneath the skin, the fat, and so on. But this technology is being developed. We're probably 20 years away. Someone told me 10 years away. I don't know who to believe, but if we achieve hair cloning, it kind of means we have unlimited donor. We're just gonna harvest 5 follicles, clone a whole million of them, and then just do the surgery.
Wow, that would be crazy. That's like a sci-fi movie. We had to make that movie.
Yeah.
You know, any type of supplements or any type of products we can take to not regrow hair, but just maintain the hair we have.
Okay, there'll be a lot out there in the commercial market,
Yeah.
in the commercial space that say that this gummy bear is going to save your hair, to restore your hair, protect your hair, and they'll say have the same health claims about inflammation and sleep and memory and so on. And if there are no large-scale studies done, then a doctor is not going to recommend them to you. An ethical doctor is not going to, certainly. And as far as I know, there are only a few commercial brands that have their stuff clinically studied, right? And unfortunately, a lot of them now are still only available in clinics and not available to the mass market at the moment. So you have to go through your doctor, get a diagnosis, get some kind of advice before you start on these supplements. Yeah.
Okay. So I think a lot of it, is genetic. A lot of it is also lifestyle. But of course, every case is very, very different, right? It's important for these individuals that are concerned about their hair loss to come see you or come see a certified expert to basically assess what is their exact issue and what needs to be done in order to treat, I think, there too. That's the most important message, I think, than anything.
Yeah, I think if you're concerned enough to see a doctor for any other reason, let's say wrinkles or sunspots, then if hair is something that you want to maintain, it makes a big part of your appearance as well in terms of how youthful you look, then certainly seek medical advice rather than pop into your nearest salon and ask them to do some kind of scalp treatment.
Yeah. One thing I forgot to ask also, let's say for people that enjoy bleaching their hair or dyeing their hair, coloring their hair, is that very, very, I think, harmful, let's say, in terms of like our hair health too?
Okay, so bleach is an oxidizing agent, right? So if it gets on your scalp, and many places now use scalp protectors, they spray on some scalp protectors before using the bleach to prevent the bleach from actually causing inflammatory changes or burns to the scalp. So bleach can harm your hair follicles. If you're doing it at home and not doing it professionally, please try not to do that. But day to day, just touching up the roots with dark dye doesn't seem to have that same negative effect.
Okay.
Henna dyes, which don't last as long, seem to be safer, but they wash off as well.
Okay. Is there anything else that you can share with our viewers here that you, from your vast knowledge of hair, that can help them maintain their hair? I think we've gone through a lot, huh?
Yeah, I think I want to bring the attention to, just because I'm on the subcommittee of this thing called Fight the Fight, which is a committee.
Fight for more hair.
No. Fight the fraudulent, illicit global hair transplant black market. Right?
Okay,
that's what FIGHT stands for.
Okay. Oh,
now,
wow. It's a big acronym.
A lot of patients actually come to me for a repair surgery. We're talking like 10 a year or more.
Okay.
They come for repair surgery because they've had a botched job done somewhere else. Now, if you see something that's advertised as too cheap or too good to be true, unlimited grafts, guaranteed results, 100% satisfaction, $1 per graft, things like that, it's probably too good to be true. Yeah, and this black market is flourishing. In France, they had a young boy, early 20s, had a botched job in Turkey and killed himself because of how he hated how his disfigured hairline looked.
Botched in terms of like the extraction of it, or like it just nothing grew back, or it's a complete cluster mess up, right?
Yeah, so the hairs were growing in awkward directions. The hairline was unnatural. Who did his surgery was probably somebody who's not medically trained. And this black market is flourishing.
Oh, no.
And I'll tell you, Singapore is not safe from the black market as well.
Not also, really?
Yeah.
I think a lot of people, Singapore has such a good reputation. With the work you've done, everything too. I know a lot of times people are considering going somewhere else because it is less expensive.
Yep.
But then they also face this risk also too.
Correct. So do your research, guys. Like really, really research the clinic that you're interested in visiting before you commit. Because once you're down there, face down, shaven, there's no turning back.
Wow. Okay, that's, I wouldn't say a dire way to end this whole thing, but definitely it's good to know. You got to be careful. We only have one head of hair and we're not going to grow any more. So definitely, 好好地把握, take care of it. It's been such a pleasure here. Thank you so much, Dr. Joshua, sharing with all this information. For all of you out there who have any concerns with your hair, take a look. If you're really, really concerned, definitely give Dr. Joshua Terra Medical Clinic a call. Take a look. They can just do a simple consultation and diagnose to see what the issue may be. And from there, what you know about your your hair, we can go from there. If you like the show, definitely don't forget to like it, share with us, share with your friends too, subscribe. It's been a pleasure. Thank you so much, Dr. Joshua. You know, I am suddenly very, very, I think, educated with my hair now too. Thank you and see you next time. Bye-bye.
All right.